The rumor starts small, like a folk tale from faraway countries.
The rapid surge of COVID-19 infections is overwhelming hospitals across the country. Some health experts predict China could suffer up to 1 million COVID deaths in the next few months. And this outbreak could also threaten the global economy.
China has identified the cause of the mysterious new virus.
Many countries aren't bothered. It is China's problem.
This is a rapidly emerging situation where there is not a cause for alarm.
There's no reason to panic at all. This is something that is being handled professionally.
It is 2019. The days pass and the year is almost gone. The rumor is getting louder. By December, alarm bells are ringing in Europe. America is panicking.
Breaking news. The first death from coronavirus here in the United States. A man in his 50s dying from COVID-19 infection in Washington state.
Doing everything he can do.
Tell you how frustrating it is.
Yet for Zimbabwe, danger is still yonder, the mountains. 2020 comes without much fanfare. For there are black shadows trolling the world's cities. The aviation industry is in panic. The little rumor is no longer a rumor. It's reality.
We now have a name for the disease, COVID-19.
Coronavirus.
Coronavirus.
There is COVID-19. China's Wuhan city in Hubei province is cordoned off. But it is too late. The enemy has long escaped. By February, no news is good news. It is death news, infection news. The world is now in panic.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries.
Let it not come to Africa, we pray. For if this happens on a green tree, we shudder to think what will happen on a dry shrub. The story that had started as a little rumor turns out to be a deadly demon that would sweep away over 7 million inhabitants of the earth. And Zimbabweans hold their breath. Maybe we can be spared. But the corona bug is merciless. Grim news comes. Case number 1, Victoria Falls. Case number 2, Zoro Makamba. In just hours, Makamba is taken away. So young, energetic, and affable. But just like that, he is gone. 1 out of 2. 50% fatality rate. Panic reaches a crescendo. The fiery enemy Zimbabweans had dreaded is in the yard. And it is a vicious enemy.
The pandemic has reached our region, and we now have to escalate our national response. Above all, we must readjust our lives and behaviors, including foregoing certain fixtures, activities, and practices we had grown accustomed to in order to keep the pandemic at bay.
COVID-19 spreads rapidly. It leaves a trail of death and destruction. Families are torn apart. Loved ones are lost. The nation is plunged into grief. Relatives and friends cannot say goodbye to their loved ones. It is a new normal. In the midst of the COVID-19 pandemic, The Nutswe family in Gororo suffers unimaginable losses. In the span of 24 hours, the family loses 3 loved ones to the deadly virus.
Sindakandifonera akanditi Mili, infact tachitoene group redu mongozowo zvemafamilies mune mawhatsapp group. Group redu ranga riri inini Sindi naVimbai. Ndobva angoti kuno kukuda asi kunzwa zvakanaka. Inenge covid. Ndotati covid zvakanaka ndikupota nchinda chinomustima kumba. But I think now he's doing well. Ndotati then after that ndobva vazotipa update vasindoti vasikana kamfana kuda kana gave right. Saka but inini I feel kuti ndofunga tatobatira flu ya. Saka I'm just going to start self-isolating. Zvanzi futi zvena mai vanenge vaitowa that same flu but magwadzira ruta flu yaka isana boita flu yakadai. Meanwhile mai vari kusendawo mamessage kuti wedwe ndabva kunoona Vimbai wo flu yaanayo handifungi kuti Vimbai akamboita flu yakadai. Ndobva pazoti was it on a Thursday zvikanzi naVimbai toda kuenda kunotestiwa covid. I think it's Beshnaf if I'm not mistaken. Zvansaka tozokupa update okudzwa kuti zvakamira sei.
Inda ndisipo I kune mu program yekubasa. Saka ndakaisirwa message my sister naVimbai. Ndaenda namai tanotestwa taita positive. Ndikati komai vari sei because mai hasn't been feeling well kumasuro kuti kwaive neproblem yekumbura yakadza. Ndamai vari nani zvavo, it's just the cough. Ndati alright ndikabva kwandiri kuuya ikoko kwemimuri sei zvanzi aindiri naniwo zvangu but it's just the cough inongobhowa because that cough was yaita persistent zvekuti munhu aitozopedzera kurwadziwa nenyaya yekukosora.
But mai vanga vagara vane gumbo ravainaro ende vane gumbo shuga yavo yapota ichimbonzika kwira ikadii. Saka we knew she had a lot of challenges. Saka baba vaitotaura kuti munhu zvaunofigwa nemukadzi. Baba was like that. Saka vaingoti munhu ugona ngofigwa nemukadzi ka sekutamba sekuseka. Tikati chatoita plan tozoya tichidi chivaona.
Mandi ndichibva ndadzoka futi. Then I saw mom vari pamumba. But vanga vataka makangochinja so. Ndikati kuchii zvanzi neni kuti chii chiri kuitika.
Mandi morning sindandifonera zvikanzi aenda kumbonomonita vana mai pandaenda kumba Mili. I don't know this change yandaona inga iri pana mai handina kuifarira. Saka Sinda akabva azonditi ndatoenda kubasa ndikanopiwa madays. Kubasa ukuri busy pandawanawo madays 4. Saka I'll be monitoring vana mai. Sinda ari nani anotomboziva mishonga neini.
But pavaitaura vaita kunge munhu aloka majozi so. Ndikati kuwa hamuchagoni kutaura zvaita sei. Akati amene kuti chii mailinda. Ndati mushonga muri kumwa here. Akati ndiri kumwa. Ndobva tikangogara zvedu tikavabikira vakadya chichi. Saka vakazoita sevaitaura idzi mai kubva ipapo kuma11 she was okay. Takutotaura nyaya takutodii ndopa vakazotanga kuti ndikuremerwa mashoulders mai ndichibva ndavambotesta shuga yachona yanga yakati kwira zvazvakuita kuti zvekakuloka majosi toenda here kuchipatara. Kanzi angatimbomira I'm okay zvese izvi ndichiri right. Then kuma11 ndikati guys ndakatravel ndakabva kuchiredzi I need to rest. Zvikanzi alright ndamonowata ndobva ndatoenda mutoilet. Saka pandakadzoka ndakutoenda ndioneke kuti vanhu vadini ndobva ndaona mai vapinda mubedroom zvinzi ndikuzarirwa. Ndobva ndati chimboitai rarai makatsamira mapilosi. Ndobva varara paya makatsamira mapilo. Later on she became restless. Vaita restless paya. Mandati maiende kuchipatara because kamupimiro kamakuita apa. Zvikanzi handi.
Saka Sindi ndobva azondifonera around past 11, 12 I think to 12. Zvikanzi Mili mupasha Mwari mai kunokoka handisi kuzvinzwisisa ndavaona vakagara vachiti ndakutadza kufema. Kwai saka ndatotsvaga mota kuti tione kumhanya navo kuhospital. Saka around past 12:01 I understand Sinda anenge akatotaura nabamukuru wedu baba Nyasha murume waVimbai. Vakati takutomhanya namai vavatowana mota. Vamhanya namai kuhospital kuya kuri sei zvikanzi vatopinda paadmission. Saka pane paperwork iri kuita iki zvine zvaanani.
Vakakwanisa kuva manager breathing kuti vafeme zvakanaka. Ndobva vati mama vave nani but for sugar ngaichida inomanage wacho ku covid ward. Ndobva tazonanga futi ku covid ward namaiko. titori mumota meme akati ndakutadza kufema pavhura mawindi emoti ndobva tatosvikawo pacovid ward paya vakamanyawo mani masisters achona achiti vachizovatora ndobva vatobuda vakagariswa pauche ndobva vatopinda muward vakatosumuka vega pauche vakanogara pambeta 2 minutes late ndakaona sister vaya vakuita vakuresuscita tona pankuru komai sister vari kuita CPR chichiri kuitika dzamaone mene mukanda tasai munhu zvavari kuita ndobva tatomira paya takatoramba taura 10 minutes late sister vaya vavo sorry gogo akuchina munhu asimuka akagara ega pambeta zvafambasi zvatoitika chichi ndakangostika ndakagara handakana kukwanisa kana kuti kudii kana kuti kudii raundi past 2 inda ndatomuka inoyeze believer unotanga kufunga zvakawanda pakanamatiwa ipapo ndiri ndega ndiri kumba uko but in my spirit I felt something was not right saka around past 2 to 3 ndaona foni yapinda akufona ndepamukuru zvikanzi ndine urombo mainini mai vashaika vanachitaura navo manje zvikanzi inovatoshaika motoshinga mainini ndozvatovepo hapana kuvati vajeka hapana kuvati apa ndandine mwana ngauya kuholiday kuti ndizhambe apa it was just something else baba manje masikati achona vakambonzi vakamborutsa kuti vanga vorutsei but vanga vakuti ndiri kuremerwa mashota zvaita mai ndakati ko zvaita sei baba zvanda mashota zangu ari kurema kati ndotora tsunami varabha mashota zawo chichini ndakati ko kufema kwakuripo baba vangu vasingakosoronga asingati ndabva ndaenda kudzokera kuna mai nazvo zvikanzi baba vari senda is grieving his wife ava vasimbonyayodi kuda kuzviratidza kaya zvikanzi alright saka inini ndakazokumbirawo kubasa ndakaravida inoti hope kunonga kusina mvura zvakanaka my sister is asthmatic ndokumbirawo chine blazer chekuti vafeme chakanaka chinonga weke ndakatobuda paiti ndakabuda kumazuva rouvira kunoko tauya paya ndawana ari kutoti vari kutotadza kutofema ndava neblazer paya ndakabayawo majekiseni nainenesi ndakabayawo majekiseni zvisitati kuti asvikaita senge zvaita nani saka nani autozombopa pamaini hazvina kutomonita kutoti munhu zviri kufamba sei toenda here kuchipatara tizoti baba zvaakuita unge zvekudhitiririkawo but was not that bad fun moziva kuti unoita kunge uri kurota zvinhu zvichiitika kuma 1 she started complaining kuti ndakunzwa mudumbu vakachema nemudumbu mainyasha zvekuti matumbu angu ari kubva ari kudambuka mai ndikasako havana chamuna chamadya hamuna kuchi avakachema nemudumbu ndikati nai mainyasha zvikaenda kufa sindi ndikusira vana vangu ndikati musataura muchidaro pamufini munofa muchindira zvikanzi
Their world turns upside down when their first daughter, Gwemende, a journalist and gender activist, succumbs to COVID-19.
manheru almost the same time yakafona izvanzanhelemuka inda kutomhanyana namai yashifti zvekuti she's having difficulties in breathing imba yanga agara asthmatic saka pavakadaro manje indakasara ndiri kunokumba and that same feeling I don't know what happens you just feel something's not right ndamuka paya ndambozama kunamata vanhu varimoka varimbosha kuti commotion yakuitika yave yeri sindi wabuda futi nababa nemurume wavimbai vaenda kuhospital ine the other friend vasvika vamhanya inini pandakatombofona kunyazozwa kuti munhu ari kurwadziwa pafoni inoingochema mudumbu mangu uchichenjiwa just praying and worshiping munhu anga achizvinamatira zvake
munhu titochiendaka kuchipatara kuzi ndandichazvikona ndobva taenda kuchipatara kuya. All the way she was just singing my names. She was praying. She was just dedicating herself to the Lord. Vasvika pakezvauti bodi yakapinda maineseka.
So when they went to the hospital in I was here, ndobva ndatozonzi around the same time zvikanzi mili zviri kuno pasina nguva foni yapindazve Vimbai washaika. Kati Vimbai yafa. Mozoti I think I just lost it.
I could do nothing. She just went about the risk. Is this happening?
Emotionally ndakatoona kuti ndotoende dambudziko chani. I just lost it. Ndobva ndabuda ndamhanya futi zvepa next door ndavanokera maikwenda Vimbai ari kunzi ashaika. Vakangobudawo vachingotora Zambia vakaperekwa. Kuti tichisvitsa kuna baba yaisvitswa sei?
Vimbai ashaika, munhu wese akaedza kuti azvibate kuti baba vasazvizive. Because Vimbai, as I said, was Sekuru's personal friend. Everyone was wild. Vanhu vakazvibonderedza, madziro akarohwa, vanhu vakafamba pa-open space up kuti Vimbai ashaika. And then our greatest challenge was, who is going to tell Sekuru? Isu tatatoronga kuti mangwana takunoviga mbuya kwaShurumanzo. Asi apa paita rufu rwa Vimbai. Chakava nenguva yakaoma. Asi pavakangozoudzwawo pane munin'ina wavo akauya. Ndiye akazogona kuvaudza kuti mukoma Vimbai ashaya. And then hatina kuona upenyu kana Sekuru. Handifungi kuti vakarwadziwa namaiticha sekurwadziwa kwavakaitwa naVimbai.
I don't know kuti maybe it's in the way that he said it, or maybe we were expecting a different response. Was pavakazodzwa zvaVimbai baba hanzi vakangonzi ndandauya kuzokudzai mukoma kuti Vimbai ashaika. Hanzi then ndobva vati Vimbai upi? Zvikanzi Vimbai wangu. Hanzi zvanzi. So he was just sitting. Ndobva vatongo, I think he just gave up somehow because we saw ngati change yachona, it was just immediate. Vakabva vatongeta gave up just like that.
Apa manje baba it was now bed. Hangu akutadza kufema. I had to resuscitate him again. Kuti mwana oxygen. Singuzamawo aendai kuda kuti ndanokwaza kwedu vakamira nawo.
So vavotoramba kana kuenda kuhospital, but we got so much help from vanhu vekubatsirwa kwaSindi because they kept on vanoshanda navo vamwe vachione equipment oxygen tank vachimonitor vachidi, but you could tell from their faces dzemanesi madhokta aiva kuti situation is right.
6 breathing yainga yatodhaka. Baba ari kuchipatara achema handidi munhu wese anoenda kuchipatara akudzoke handidi ndikana wachema ringati baba mberi ndini murondi 6-7 but ndikazotandi I think I just knew it. One of the cars wataenda vanongoenda ku
10 minutes later it was the same news. Baba vakashaikira pabhati apa uchimanyana Sindi akatoti kwanzi ndakatovaona vachitoni and I didn't tell people. Hanzi ndakatozwadza takusvika kuti tangomhanya zvedu munhu uya adu munhu afa.
But vanhu andandinawo mota vanambozviona vanangoti vangovasiya because ndandina Sekuru mwana wanjadzi yamai vavo. Sekuru was a bit drunk vachingotaura baby vachitaura nemunhu wavo nokunouyu kuti munhu adu akaenda kusvika kuchipatara same scenario amhanyamhanya nemauichari nemandanda achipera chakosindinaka munhu akasinda kuti apasina munhu seindingati apasinda vanhu chivatoenda paafa. I watched him go sezvandakatoka mamunhu.
In a tragic turn of events, the Nutswe family loses their father just hours after losing their elder daughter and mother. The 3 family members gone in just 24 hours. Communities and families cannot come together to grieve their loved ones, let alone bury them. It is a strange form of a funeral that the Nuswe family goes through in grieving their mother, father, and sister.
So when the news came again, it was a whole lot of issues. And a lot of people were calling. And it spread like a wildfire, like a wildfire. And you know, my communities are sana mkopa, mamuninga makakura munasanga chiza. My father, muna izvikano. My woman is vikano. Chechi Vimbai was a journalist. Muna izvikano. So it was just one after another.
Sakatakazo no yika maina baba. Bata nzapo Vimbai kazo no yiko kumshoka kwa Sakana maita kanga na ukachuru. Wavika one test. Right, it's chumuka tishinda chimeta wajanga.
Imelda Kwenda is a neighbor to the Nutswe family. To attend or not to attend the neighbors' funerals? Suddenly, that question becomes fundamental. Like the choice to live or to die, it is a difficult call, a cruel fate to put one in such a situation.
Vana vaitanga kuudza ini rufu, saka kuti ini ndizoramba ndakagara kana kuti nditi ndirege kuenda zvaindiomera. Akatanga kunyanya kurwara ndimai, akatoudzwa manheru kunzi tichambomhanyisa mai kuchipatara. Ini manheru akareiwawo Sindi akadzoka akati mama akusisi. Ini ndichinyatsoziva kuti vanhu vafa neCOVID, but I had no choice. Handisaivharira Sindi pamba pangu kuti usapinde mumba. Iye achitiwo ndiri kuenda kunochema namai. Ini handisaigara mumba mangu kuti nditi andiudza kuti mama vafa. Ndoti rega ndigare nekuti kune COVID. Ndakangotorawo, it was night time. Ndakangotorawo juzi rangu ndikapfeka ndikaenda. Asi ndakaona kuti kama nokuda kweCOVID unopera. Pakuenda kunoviga mbuya nasekuru, basa rikaenda repaired. No neighbors, no friends, no churchmates, no relatives. Dzimwe dzataiziva dzaiuya pamba ipapa but havana kugona kuuya nokuda kweCOVID. Chero vana vamai vangu vaifona vachiti bvaipo, tati bvaipo, murikuda kuzodza vana chirwere chanti muri kuti pafiwa. Ndikavaudza kuti ndo hama dzangu dziri kunedzodzo. Imi pamuchabva kwamuri ikoko munondowana ndachengetwa nevanhu ava. Saka handikwanisi kubva, asi what I can only tell you is I am safe. Saka even up to now ndinoti ndikasimudza musoro wangu ende ndakanangana nepabedroom pavo izvozvo tinotarisira kuti kuda mumwe musi ndichasangana navo vachifamba.
As numbers are spiraling out of control, the number of casualties is frightening. But desperate times call for desperate measures. Gwemende Provincial Hospital breaks new ground. A team of medical doctors at Gwemende Hospital managed to deliver the first ever COVID-19 era cesarean section birth. Dr. Mkwembi leads the team, but assembling the medical team for the cesarean section had been a Herculean task.
It was really difficult. It was a first for me. It was a first for the country, and I'm sure even for the whole of Africa, it was actually a first. So it was really difficult, and that time it was at the onset of the pandemic. Everyone was afraid of COVID. We had probably just about 7 COVID positive clients within the province. And these were not in the community. They were not in hospitals. They were actually in the quarantine centers dotted across the province, right? So to get someone who needed to be hospitalized and who needed to be operated on, it was really a nightmare for us as a hospital, as an institution, to handle.
When COVID started, it was a very scary story for everyone. We were actually quite unlucky to be the first group of specialists to encounter a patient who needed an operation when she had tested positive. And I remember those days when Dr. Mkwembe called me and said, we've got a patient for cesarean section who needs a Caesar. I couldn't sleep for 2 days because I was scared.
Initially, fear had run rings around the doctors, and some suggest transferring the patient to another referral hospital in Harare or Bulawayo.
Right. We tried to refer these patients to what we thought were better resource centers. Right. We tried to refer to Harare, Bulawayo. We think maybe they've got enough infrastructure, but the resistance, we just had to operate on the patient.
With no one prepared to take the patient, Dr. Johannes Mkwembe has no choice but to operate on the patient.
Yeah, what made us push to operate on the patient mainly was she was also a health worker. She was a nurse, right? Yeah. So she had traveled to South Africa for a shopping, we call it preparation, in Zimbabwe. So when she got back, when she was in the quarantine center, that's when she was noted to be COVID positive. Right? She was almost due. Right? She was 2 weeks before the estimated date of delivery. She needed a cesarean section. Right? She was not going to push because her history suggested that she couldn't go into labor. So she needed a cesarean section, right? We looked at our facilities at this hospital. We've got one maternity theater. That's where we do our non-COVID cases, right? Yeah. So we were thinking, if we're going to use this theater, right, then what does it mean for all the other patients? Considering we do an average of about 7-8 cesarean sections a day, what was going to happen to those 8 emergencies when we've done a COVID case, right? So we looked around within our hospital. We adapted some space that we used to use for other small procedures, some small theaters, right? Yeah. We made renovations, right? Yeah. So that we could do an operation there, right? Of course, we tried to make it as safe as possible, right? It was not a proper theater, but at least it was a small theater, so we had access to oxygen and all those things. So we renovated the place. We engaged a team of pediatricians, anesthetists, psychologists. We had a psychiatrist on board to deal with the trauma associated with dealing with these cases, right? Yeah. Nurses, midwives, general hands, right?
Then I had to go down to the books, try to read how am I going to keep myself safe. And at that time, there was actually nothing in literature. No COVID patient had been operated thus far. So we had to come up with our own way to get around it. And we set up a very good team. We discussed among ourselves how we were going to safely operate on this patient. And our team comprised of 25 people who took care of that patient.
It is the first such operation in these crazy times. Procedures are rehearsed and re-rehearsed. Nothing must go wrong.
We used a volunteer approach. People volunteered in, those who wanted to assist, right? Yeah. So we came up with a team of around 20 people who were going to assist with this case, right? I was the team leader. So we came up with a schedule. We would do meetings, right? Yeah. We didn't have time anyway because we needed to operate the patient in like 7 days, right? So while our renovations were being done, we were actually preparing ourselves, right? So the entire team, we started from the basics, right? How do you don and doff is kupfeka kwatinoita hembe dziya dzinoshandiswa protect against COVID. Yeah. So we took our team through how do you don, how do you doff, right? All the infection and prevention control measures, right? After that, we then came up with a roster of the duties that we're going to do, right? Who is going to be doing what? Who is the timekeeper? Who is going to operate? Who is going to nurse the baby? Who is going to clean the room? How are we going to bring in the food, right? Yeah, with everything we had to organize from scratch.
Gweru Provincial Hospital is on the verge of being the first in the country to conduct a C-section on a COVID patient.
We had to test our system, right? So we were to run a drill on a non-COVID patient who was supposed to undergo routine surgery, because we wanted to test our theatre. We wanted to assess our preparedness in terms of how we're going to put on the attire and everything, right? Yeah. So we did it, I think, 2 days before the surgery, right? We took in our patients, we did the surgery. Surgery went on very well. We identified gaps that we thought, okay, we really need to change here. But it was mainly basic things like what sort of shoe size do you need to put on, what sort of sizes in terms of the gowns do you need to put on. So it was mainly basic things that we changed, right?
Secretary General for the Medical Doctors Association, Dr. Mativeke, drives all the way from Harare to Gweru to give his team moral support.
When we thought we were now ready, right? Yeah, we also invited even our colleagues from Harare, right? I remember one of our Secretary General for the association, Dr. Mativeke. He actually drove all the way just to encourage us. Right, he drove all the way, he came, so what have you done? We showed him the place, right? Yeah. Then he said, you can do it, right? Even the anesthetist colleagues, they communicated with their colleagues in Harare. They were even given some of the equipment that we wanted to use to make the surgery as safe as possible, and also to reduce infection to the attending teams.
Another medical team of 20 who had been in direct contact with a COVID-19 patient at the hospital tests negative. Suddenly, stigma at the hospital is significantly reduced amongst staff.
For our team, soon after the procedure, it was very difficult for all of us because everyone was afraid, right? Yeah, you're moving around in a corridor and everyone is running away, right? Some people, they don't want to go home to be in contact with their loved ones, with their children, right? So for this particular team, it was a first. It's not like this was according to guideline, but we had to quarantine them because of the stigma, right? Yeah, we use public transport, but whenever they would get to the super, people would run away, right? So we decided, okay, I think just for this case, let's look for a place here in Gweru for the team, right? And they stayed there for about 14 days, right? We did exit tests on day 7. COVID tests on the staff, day 7 and on day 21. All of them, they were negative. No one contracted COVID from the exposure time with this client.
The process has setbacks, as some medical personnel are developing cold feet as the day of the procedure nears. One of the nurses pulls out.
It's a very difficult decision, I have to say. Like I said, initially the initial response was, let me just refer this patient, right? Yeah. But it was mainly out of responsibility, right? To say, I'm a specialist here in Gweru. I've got a client who needs my service here in Gweru, right? If we don't step up, who is going to do it for us, right? Yeah. So we tried to manage the case at least within our capacity, and as well, she was a healthcare worker. I'm thinking she has helped so many clients now she needs help. We refuse, right? So I think those two things they really pushed us to say, okay, maybe let's assist. But I would admit it was very difficult for everyone involved, right? Yeah. I actually remember one of the nurses, she pulled out the day before the operation. She told the husband, we want to operate on this patient. The husband is like, no, we are going to operate on this patient. Please don't come back. Right. So it was very difficult, but we just had to do it because she was a Gwemende patient, right? Yeah. And we are in Gwemende. We've pledged to save the people of Gwemende. So we decided, okay, let's just do it.
I didn't tell my parents that I was going to be on the team. They actually saw it on the news. And yes, definitely, we're sticking. A lot of people would actually stand back from them. These are the guys with COVID. The nursing team, a lot of the girls, the husband said, don't come home, don't come back home for the next 2 weeks because you bring the virus to me and the children. So a lot of the team actually had to isolate there's a local hotel that offered accommodation for the team for the duration of isolation. So yeah, the stigma was definitely there. This was just the first 3 months of the pandemic. Everyone was still very, very scared.
On the day, we invited the Gororo City Council ambulance crew because they're in charge of the infectious disease hospital. So we had to get them involved. So the ambulance crew from the Gwemende City Council are the ones who were to go fetch the patient from the quarantine center, bring her into the hospital, right? Yeah. We received our patient, moved our patient into the operating theater, right? What we tried to do, we would take turns to get into the theater because we didn't want everyone to be exposed at the same time. So we would take turns to say, okay, who goes first? So it was mainly the general hands wheeling the patient into theater. Then when they're done, they would get out. Then the next, it was the anesthetist who would anesthetize the patient, right? For these clients, because we don't want them to breathe back into the machine, otherwise you need to decontaminate the machine. So we preferred regional anesthesia, what we call a spinal block. So this patient would actually be talking to us, but she will be anesthetized half the body, the area that we wanted to operate. Yeah. The anesthesia went on smoothly. It was not a problem. Because our main problem was if we needed general anesthesia, if we needed to put this patient to sleep, what does it mean for our machines and all? But we did have a machine on standby just in case, right? But the anesthesia went on very well. Then next it was the surgical team going in. Of course, the anesthetist will be monitoring the patient, talking to the patient, but it was the surgical team, myself and the scrub sister. Surgery was fairly routine, right? Yeah. Otherwise, for a COVID positive patient, there's nothing else in terms of the surgical side. It was a fairly routine cesarean section. We did it, I think, in good time, about 25 minutes, we were done, right? Then next in, it was the team of the pediatrician and the midwife, right? Yeah. They came, they collected the baby, resorted the baby, moved the baby to the recovery.
0847. The baby is delivered.
When you're done with the surgery, what was left now was to monitor the patient, because you can't just do the surgery and return the patient to the quarantine unit. Right? So we adapted a place again within this same environment that we did the patient. Right? There were about 3-4 rooms that we used as the wards for the patient. Right? Yeah. So she was there for 3 days. Our nurses would take turns. 6-hourly duties, right? Yeah, they would monitor the patient, right? We did tests on the baby, right? Just to check if the baby was infected with the COVID. The baby turned out to be negative. 24 hours, even the follow-up tests, all of them were negative.
It was a very proud moment for me and the whole team, because at the time when we went in to do that operation, we didn't realize what huge step we had taken. particularly for the province and also for the country. Because after that, when we had published that story, I got a lot of invites, even Dr. Gwemende got a lot of invites to present on international forums on how we went through it. I presented at a forum in Kenya, I presented via Zoom at a forum in Brazil, just to tell our story, how we managed to safely go through something that had never been done before.
A Bulaya Polytechnic principal, Engineer Gilbert Mabasa, is rushed to hospital. Affectionately known as the teacher, Engineer Mabasa has contracted COVID-19. His wife, of Swiss origin but affectionately known to the community as Mandlovu, is hopeful her husband will pull through since he has no underlying conditions.
He had been sick for about 2 weeks. I had been sick for about 1 week at that point in time. He had got worse. We had actually managed to get a neighbor to get us an oximeter because I was in isolation, self-isolation, because we were sick and he was off. So we were working from home. And then he got worse and I ended up having to try to get him to the doctor. They got the Polytechnic, Bulawayo Polytechnic driver to take him. Unfortunately, in that process, when they sent him for testing, then he tested negative. And I mean, we were like, no, this is not right. But anyway, so he went home again. He had some initial treatment there at the doctor's. Then the following morning, his values were like really bad. So I tried to get an ambulance, couldn't get one. Got hold of the Polytechnic again, so they came and took him to UBH, where they were reluctant to admit him because he had had a negative test. And finally they retested, and when that result came out, they finally admitted him. But because we were both fully vaccinated, we had no underlying conditions, and our BMI, which is another thing that counted at this time, it was normal. So I think everyone was like, okay, we have tested positive, we're gonna just go through this COVID and everything is going to be all right at the end. That was, I think, the general feeling. Then of course, as it took longer and he was getting worse, we were just having to trust God and say, well, God is in control.
But it is the last day Mrs. Mabasa and the children would see him. For Mandlovu, the last piece of closeness to her late husband are the WhatsApp messages she shared with her husband while in hospital. She holds these messages dearly.
I think the last ones are maybe the ones that are most important in one sense, because they show what kind of person he was. We talked about things, practical things like sending some more towels over, some fruit juice and what. So we talked about those kind of things. And I'm saying, like, your parcel is on its way, because the drivers were going to take it there. But then the last part here is I had a message from our daughter about our granddaughter. We have 10 grandchildren, but this particular one, who at that time was about 2 years old, her name is Makanaka. And it says, Maka wanted to see Kulu this morning. Was not quite happy with only getting Gogo, meaning me. She's home from daycare, looks like she's not only looking like Sarah, which is our second-born daughter, but having tonsillitis like Sarah as well. And then he says, sorry about the tonsillitis, we pray for its total removal. But there were quiet periods when he was now weak. And I was told afterwards that they tried to phone me, but they had his number as my number. So they couldn't get me. They wanted now permission to intubate. And so eventually he had to sign for himself, and they did that. And then they couldn't get hold of me still until a friend of ours who worked at ICU came on duty. And of course, she had my number also. So that's when they finally called me and said, we have intubated, he's now like in ICU, things are like not good. And she was telling me this, and she said, I'm going in now. Like I'm scrubbing up and putting on and going in. So she went in. And just after she got in, that's when his heart stopped. And she's the one who actually tried to resuscitate him. And then I got the call saying, sorry, we lost him.
The family is not allowed in the hospital. Even in death, they are not afforded an opportunity to say goodbye.
Mr. Mabasa was a person who believed in God, and he was a Gideon. I don't know if you know the Gideons, these guys with the Bibles. So he would always move with this and always talk about God. And I firmly also believe that there is always a plan. So even with the funeral now, we have family and friends all over the world, and both his relatives and my relatives, and they are all over. There are thousands of people from his groups who would have wanted to be there, but because of COVID, we only were allowed 30 people, which of course was very difficult, and also the time frame is so short with COVID.
In a normal environment, multitudes would have attended Gilbert Mabasa's funeral. The COVID-19 period is not normal. Only a handful say goodbye, but without viewing the body.
But because of that also, we had to make a decision to invest in having this directly broadcasted on Facebook. Now, because of that, the following, on the Sunday evening, this was a Sunday funeral, I phoned my mother in Sweden, who is 91, who is not on Facebook, but who had a neighbor who was on Facebook. And she tells me that what was happening about those white chairs, which was the beginning of the transmission. And I'm like, so you watched the funeral? And everybody else who was out there was actually able to be part of the funeral, which would not have been possible if it had been normal. So although this could be seen as a tragedy, only 30 people can attend. In fact, it meant thousands of people could actually attend. So God always has something good coming out of everything. Romans 8:28, all things work together for